Hey everybody, happy Labor Day. Hope everyone has had a good and safe weekend. I'm enjoying a little bit of the outdoors. I've been just lounging around on the couch today, so I'm sorry I don't have on my stage makeup for you all, but I thought it would be nice to sit outside. It's a beautiful day. So, like I was saying, I hope you all had a great 3-day holiday weekend and you were able to enjoy some time and some relaxation. Today, we are going to talk about some medical and COVID related myths. And I did get some good questions from you guys, and so I've got a few things that we're going to touch on. I'm going to try to keep it simple and fairly short so you guys can enjoy the rest of the day. And then I've got our topic already, I think, that we'll talk about next time. So, the first one that I'm going to address is all of the information and the data that came out from the CDC regarding the death rate of coronavirus. So, they came out with a report within the last couple of weeks that talked about some of the death rate information, and some of that information was a little bit misconstrued, especially in the media. And so I wanted to explain and comment on that a little bit. So basically, what the CDC report said was that 6% of the total deaths related to coronavirus in general had only one cause of death, and that being COVID, listed on their death certificate. And so 94% of the other remaining deaths that were related to COVID had other conditions listed on their death certificate. So, to break that down a little bit, you kind of have to know how we fill out death certificates and how that process works. So, each death certificate has to be filled out pretty specifically, and it's very, very rare, pretty much unheard of, for only one thing to be listed on a death certificate. So, the kind of primary, most immediate cause of death is typically going to be listed as the first thing on the death certificate, and then you kind of have underlying causes or contributing factors. So the easiest example to understand right now is if someone comes into the hospital with coronavirus and they end up on the ventilator and subsequently die, the primary reason that they died is because their lungs failed. They had respiratory failure. Their lungs could no longer function well enough to pump blood to the rest of their body. And so when that person passes away, respiratory failure would be listed as number one. And then the reason for the respiratory failure is that they had pneumonia, and that pneumonia was caused by coronavirus. So that statistic of the 6% of people having COVID as the cause of their death only would not include that person's death certificate in that example. And that's not accurate. That would most certainly be considered that person's kind of true cause or reason that they really passed away. Some of the conversation around that as well has been related to the fact that so many people have, chronic or underlying conditions, and, that's really the reason that they died. But for many of these individuals that have higher risk conditions or other chronic comorbidities who develop COVID, they're not dying because they have that comorbidity. That condition just puts them at higher risk, and so they're much more likely to die. So when you look at those numbers, in America specifically, about 40% of us as Americans have at least one chronic underlying condition like heart disease or COPD, diabetes, kidney disease. And so that's 40% of our population that is at a much higher risk of severe illness related to COVID, and a much higher risk or likelihood for death related to COVID. So I think those are some important caveats to understand about that, and how we kind of talk about that risk, and how we talk about the impact that it's having, on society as a whole. It's also not only the people that get COVID, right? So back in July, especially, and coming into August, we were having big conversations about the ability to get care for other conditions because the hospitals were full, and we were having a big problem with access to care because the hospitals were full of patients with COVID and complications from COVID, and you couldn't necessarily always get access to the care that you needed if you had a serious injury or another serious illness. So those are really important things to consider, especially at the stage that we're in now. I think one way, if you kind of want to look at the death rate or percentage or the likelihood, one good way to kind of estimate that is to look at the number of excess deaths that are occurring right now. So if we look at the information just from the month of August and compare the number of deaths that we've had per week in August to the number of deaths that we've had in August per week for the last couple of years, we're averaging a higher number of deaths. And the main reason, or the main driving force behind that, we really do suspect is related to COVID. Now, it may not account for every increase in death, but for such a large number, it would be very unlikely for something else to be contributing to that. So that is another good way to look at that. We know that we're seeing more deaths than we would normally see, especially this time of year, and that's the biggest factor that we think is influencing that. One other caveat sometimes to the way that we report these things, all of the death certificate data and that kind of information, it can be really difficult to know the true cause of someone's death if they have not been in the hospital and had a lot of testing and had people taking care of them for several days. So when many of these people are dying in a care facility or in their home, it can be really difficult to truly estimate that and truly report that. So we do think that the numbers are a little bit underreported, and so likely all of the reports that we're seeing, the true numbers are probably a little bit higher. So those are just some important things to take into account when we're looking at that impact. One other question that I got, or a kind of a frequent thing that I'm seeing in my clinic, is the difference between what quarantine and isolation mean. So they're a little bit different, and they refer just to kind of two different types of scenarios that we're going to encounter in a pandemic like this. So quarantine is where you're staying home, you're not going anywhere, you're kind of observing yourself because you've been exposed to someone that's got the virus. So if I had been around someone for 15 minutes or more over a day or a couple of days in close contact within 6 feet, but then they found out they had tested positive, I would be considered a close contact that's at high risk of getting COVID, and I would need to quarantine for 14 days. Now, the reason for that is that we can see many times people will have a delayed creation of enough viral particles that they become positive and they become shedders, and that can happen sometimes up to 10 days after exposure. Really, truly, we've seen some cases up to 14. So you may think that that's a little bit of an over precaution, but the reason it's there is because we have good data to support that. So quarantine, again, is for someone who's been exposed to a positive case of coronavirus, meaning that they've been within 6 feet of someone for 15 minutes over, a cumulative time period. And those people that are quarantining to observe for symptoms and see if they're going to get it are supposed to stay home for 14 days. So that's important to remember. Now, isolation is for those people who are confirmed positive for COVID. So if you test positive, then you have to isolate yourself. You can't go out. You can't be around anybody else. Anybody in your home you need to be mindful of staying away from and try to isolate there as well. And that's to decrease their chance of getting it. So if you're isolating because you have a positive COVID test, then the time frame that Mississippi is now transitioning to for most people, not everybody, but most people, is going to be 10 days. The caveat to that is going to be that you have to have no fever for 24 hours without using medicine like Tylenol or ibuprofen, and you have to be feeling better. So if you're 10 days from the day that you tested or the day that you got sick, your 10 days comes up, but you still have a pretty bad cough or you're still short of breath, you need to continue your isolation longer. And that's something that you can always go over with your doctor. But in general, especially for people with milder cases, we're going to be transitioning to that 10-day isolation from the day that you tested or the day that your symptoms started. So those are two important distinctions to keep in mind. Now, the next question that I got, I think, is a really important one too, and that's comparing the common cold or a sinus infection to coronavirus. So, we're seeing a lot of people that are having kind of mild cold symptoms. This is the time of year for a lot of us Southerners that the fall trees and grasses start to bloom, and we start to get some of those mild allergy symptoms. It's coming up quickly that it's about to be flu season. And so a lot of us are going to be getting those kind of fall sniffles and sneezes and coughs and all that kind of stuff. So this is something that's really hard to distinguish. And it's a great question. Unfortunately, like anything in a pandemic, there's not a great answer. And so it's very true that people are getting very mild symptoms. They think it's their allergies, or they think they, slept with the fan on, or they were out working outside, or it's just kind of a regular little cold and they don't really think anything of it. It's not something they would normally go to the doctor for, but we're seeing a lot of cases like that it is coronavirus. So it's something that you need to be very cautious about. And I really recommend and suggest that if you feel like you have any difference, if there's any symptoms of concern, anything that could remotely possibly be coronavirus, that you talk to your doctor about it. My clinic, for example, we're going to be doing virtual visits still, definitely through the end of the year. So that's a really easy and quick way to talk through your symptoms, figure out really if you need to be tested or not, if it is something you should be concerned about, and then we can find the best and most appropriate way to test you, while we also limit your exposure to other people who may have coronavirus or who may have other illnesses like common colds or flu and that kind of thing. So I'd really encourage you to be aware of those things and really reach out to your primary care doctor and talk to them to determine really what your risk is and what they would recommend for you based on your area. The next question that I've got is about hydroxychloroquine as a prophylactic medication, which is a good question. There's been a lot of talk and discussion about hydroxychloroquine as treatment for someone with coronavirus and taking it as a preventative measure to prevent you from getting it. So there's been a lot of studies on this. A lot of them are still ongoing, and there's really not a great clear answer. Of the studies that have been done, there's no clear evidence to suggest that taking hydroxychloroquine is a good preventative measure. And the kind of side note or caveat to that is we know that there can be a lot of potential side effect with that medicine too. So most of the studies that have been done so far, there's been a fair number of side effects that have been much more in the medication or the true study group than there have been in the placebo group, where people did not get that medication. So that's one that unfortunately we just need more information to really support that. So it's something that you're not going to see recommended by most of us in the medical profession because we just don't have the good information that we need to feel like it's a safe option where the benefit would outweigh the risk of that. The last topic I'm going to touch on, had it on my list, Jennifer, so I'm glad that you brought it up too, is flu shots. So there's a lot of myths out there about flu shots. I actually did a project on this in my residency training about people's apprehension about getting a flu shot. So probably the most common myth that we hear in the medical field about getting a flu shot is that if I get the flu shot, I'm going to get the flu. That's not true. It did in the past. It used to be a possibility because we used to use live vaccines a little bit more than we do now. And so way back in the day, that was something that was a possibility because we were using some of the viral particles to give your body the chance to create an immune response to the flu virus. But these days, we're using pretty much all killed virus vaccines, which means that you're not getting any live particles. There's no chance of getting the flu from the flu shot. A lot of people will sometimes feel a little bit achy after they get their flu shot, and that's because your body's immune system is working to make the antibodies that it needs to fight off the flu. So that's a totally normal response to get. Now, a lot of people can get the flu pretty close to getting the flu shot, but think about why that may be. It's because we're giving the flu shot in flu season. And if you go to a place that you're going to get a flu shot, you're possibly going to be around someone who has the flu, or you may have encountered them at work or at a restaurant or something like that in the couple of days beforehand, and it's going to take a few days to show up. So very possible that you could still get that, and it's just a simple coincidence. One thing about the flu shot, you definitely should get one every year. We know very well that they change and they're different strands each year. So we do our best to target what we anticipate the change is going to be and give you the most effective, most likely chance we can at preventing the flu. That's a good topic as well. We can't always prevent the flu. So none of the things that we use in medicine are 100%. Some years the flu shots are better than they are in other years, and that's just kind of the way that things work. But the primary thing about flu shots that you should remember is that if you do get a flu shot and you get the flu that season, you're much less likely to require a hospital stay because you get so sick from the flu that you can't stay home, especially for those of you who have things like these comorbid conditions that we talk about, like hypertension, heart disease, diabetes, kidney disease. That group of people, just like they're at higher risk of getting COVID, you're at higher risk of getting the flu and getting more complications related to that and more likely to be in the hospital and potentially die. So the flu shot can protect you from getting so sick that you develop those complications as well. So that's one thing to remember too. It's not necessarily 100% guarantee that you're not going to get it, but the likelihood that you get very sick from it is much less if you get the flu shot for that year. One other thing that we think about flu shots is that you typically probably retain some of that immunity over time. So as you continue to get flu shots yearly, we think your protection's probably a little bit better from year to year than it would be if you didn't get them. So that covers most of the myths that I got questions about this week. One thing I want to mention that might be helpful with myths is there's a great documentary on Netflix that is specifically related to COVID. It's pretty easy to find if you just search COVID or coronavirus explained, I think is what it's called. I've posted about it before. But it's really simple explanations of kind of how we got to where we are and where we're going. I haven't looked to see when their most recent updated episode was, but it's a really good basic explanation of the things that we need to understand when we're in a situation like this that is a pandemic and we've never been in this situation before. So I hope those answers were helpful. Keep the questions coming. I think next week I'm going to talk a little bit about how to look at and interpret scientific data and information. That's one big problem that we're having now, is that some of our scientific information and study data is getting maybe a little bit misrepresented or misunderstood. I'm no gold star expert on it either, so it's difficult to understand, but I'm going to try to break some of that stuff down so that you guys can understand a little bit better when you're seeing some of this stuff in the news, what makes a good study and what helps us know if it's reliable information to follow. So I hope that was helpful. Remember to keep wearing your mask and keeping your distance and washing your hands, and I hope you guys have a good 4-day week. Stay safe.